It's time for On Point, where we speak to experts to delve deeper into some of the key issues in the spotlight right now. The number of new COVID-19 cases has been on the decline here in South Korea, with Monday's tally 20,000 marking the lowest figure for 10 weeks. So what now for the country, and what about the rest of the world? To discuss, we have Dr. David KWAK, Assistant Professor of the International Clinic at Soon Chun Hyang University. For more, good morning.
Good morning.
Now first, the country's decline in cases comes despite a long holiday that prompted a massive movement among people in the country. We did have a slight uptick, but that's right now is certainly a good news. But are we really out of the danger zone?
Well, I don't want to be the person who actually ends up scaring people, but as a physician, I don't think I am really free to say that we're completely out of the danger zone yet. It being from the fact that we still have the littlest possibility that this smallest seed of fire can still sprout up to cause a mountain fire, meaning we still have the virus transmission spreading through the nation, despite the fact that it being very, very low, probably the lowest in a short while. I believe we've hit about 19,000 of confirmation cases yesterday. And also, we're seeing roughly around 300 or 500 or so people being admitted in the ICUs, and also having about 30 cases of death per day. That shows me that even though we are on the decline in regards to the curvature, we're not completely safe with the numbers yet. We don't call influenza, for example, safe to deal with. We don't call tuberculosis safe to deal with. So even though we do foresee that we are going to have much brighter and safer future, I'm not going to call ourselves completely out of the danger zone where we can just run outside and really feel free to not care about the virus. So we should be careful about that. But I do foresee also that we will go further down in the confirmation cases numbers.
Right, you're not going to be completely out of the danger zone when it comes to an infectious disease like this. But that brings to the second question, as the government has begun discussions over lifting the mask mandate. Are you personally, as a doctor, for or against the mask mandate right at the moment?
Well, I'm actually for the mandate of keeping the mandate of masking, that is. Even though we do see in many other countries that lifted up the mandates for keeping the mask on inside or indoors, I think it works better for us if we were to keep the mask on. I do see a lot of people, especially the younger generations, complaining, comparing ourselves to many other countries around the world that, such and such countries are lifting their mandates. Why do we keep it on? We have to remember that our social distances really differ from that of other countries. Even though we see large, massive, concerts going on, and also a lot of people gathering in very proximate distances in the outer parks, there are still situations where we have to come across much elderly people or much more vulnerable people with, heavier underlying diseases and whatnot indoors. Let's say at a supermarket or department stores and whatnot. So I think for the time being, as we gradually move on to the next phase of the pandemic, I think it'll be safer for us to keep the mask on at least in the indoors, but rather go easy on the outdoors.
Right, and as you mentioned, people have been comparing our situation with other countries, but now looking at the other side of the spectrum, China's COVID-19 situation seems to be getting better, with some of the lockdowns being lifted. Well, they famously have the zero COVID policy. Do you think that's what's worked for China?
I honestly don't think it's worked because it's not completed yet. I believe that when they start lifting up the complete lockdowns in certain geographical areas, they're going to see certain numbers of cases sprout again. The zero COVID policy, I don't think will ever physically really work for an entire country. That being said, us having gone through the massive numbers of natural infections on top of having most of the people inoculated worked better for us because that gave us the higher level of immunity against future possible transmissions. As opposed to China, because they have locked down so strictly, the people hasn't gotten enough exposures and chances to get natural infections and be immunized with such methods, even though they claim that they have inoculated themselves. So they have to depend only on the vaccinations to count for immunity against upcoming COVID-19 situations. So I think they're more in a vulnerable place where compared to other countries that have gone through natural infection transmissions. Zero COVID policy, I don't think it's never feasible completely. Also in a sense that future-proof, I don't think it's going to work as well as the other countries that have gone through natural infections.
Well, thank you so much for your insights as always, and thank you for joining us this morning, and have a great day, Doctor.
You too. Thanks for having me.